Endometriosis is a disease that affects millions of women around the world. Joining us now with more details on it are Dr. Loxley Christie of the Hugh Winter Fertility Management Unit and Shauna Fuller, founder of the B.A.S.E Foundation, who's herself been diagnosed with stage 4 endometriosis. Good morning.
Good morning.
Smile Jamaica, it's morning time. Let's start with you, Dr. Christie. As best as possible, explain to our viewers, what is endometriosis?
Sure. To make it simple, endo means inside. Metrium refers to the muscular part of the womb. So the endometrium is the tissue that's normally found inside the womb. When it's there, it's fine. It does what it's supposed to do. When it gets outside of the womb, however, that's when it wreaks havoc. So endometriosis refers to the endometrium being found in tissue outside. So that's usually about 90% of it is in the pelvis, or the lower part of the abdomen. But actually, endometriosis has been found in almost every tissue. So it can be in the breast, in the lung, in the eye, in the brain.
The challenge I find with issues such as these is it takes so long for the affected person to identify what it is. Because, as you said, it presents itself in all parts of the body, so you think it's something else. For the women who are watching, you know, how best can they maybe identify early signs? Well,
I'll disagree with you in the sense that it quite often shows up early.
Okay.
It's just that if you're not sure what you're looking for, or if you're being seen by the wrong person, then you quite often misdiagnose. So it quite often goes undiagnosed, and then persons present late.
Okay.
And as such, they have far more severe complications. The primary complaint will be pain. Again, the tissue, when it's found in locations outside of the womb, it causes inflammation, and with inflammation comes pain. Since over 90% of the tissue is found in the pelvis, these patients present with often debilitating, really horrendous menstrual pains. The pains are actually pretty characteristic. It usually starts a week or so before the period, and is usually located in the lower abdomen and quite often in the lower back. These are the patients who will classically miss work because of their periods. It can also result in infertility. And depending on the other locations that they are, if it's in the lung, for example, quite often these patients will present with lung complaints. And it's characteristics around about the time of the period. So every month they'll have these chest pains, chest tightening, or if it's in the brain, sometimes people will have seizures at that time.
Wow. Shauna,
yes.
What's been your experience?
Well, first of all, thanks for having us to speak about endometriosis. My experience has been chronic pain since probably 2002. And in 2009, my lung collapsed.
Wow.
My lung collapsed, and I was treated overseas. They did cardiothoracic surgery, and the doctors didn't know what actually happened. They kept on asking me if I was exposed to an infectious disease, those kind of questions. And then it wasn't until I returned to Jamaica, met up with Dr. Christie, and he was able to diagnose me with stage 4 endometriosis at the point of the laparoscopy.
Wow. She's stage 4. What are the stages?
All right, so you have stage 1 to stage 4. Stage 1 will refer to small endometriotic deposits. And by small, I'm talking about deposits that are less than 1 millimeter in size, which again leads to difficulty in diagnosing it. So it's difficult to pick up on ultrasound, MRI, and those sort of investigations are helpful in later stages. As you get increasing deposits in terms of more on the bowel and other organs, then you move up in terms of stages. So by the time you get to stage 3 and stage 4, much of the pelvis is involved. And by that we mean the intestines, the ovaries, the fallopian tubes, everything gets all matted down. I like to think of it as having a bowl full of balloons in there, pour glue in there.
Wow.
And then try and separate those balloons. And that's how it pretty much looks at the time of surgery by the time you get to stage 4. So it can be
is
quite
stage
busy.
4 the worst stage?
That's correct.
Okay.
Thankfully.
Wow, Shauna.
Yes.
So you formed the B.A.S.E Foundation.
Yes.
What is the idea behind it?
Well, B.A.S.E stands for Better Awareness and Support for Endometriosis, pretty much going through what I did and not seeing a support network in Jamaica, because I'm very active in the online community with my endo sisters. I sat with my husband and my family and we said, okay, let's start this foundation. And our mission is to provide information and support to women who suffer from this disease, create awareness amongst the general public, women, and in the medical profession, so that we can have proper diagnosis earlier. We want to promote research in the medical field as well, get some statistics on how many women in Jamaica have endometriosis, you know, how long does it take to be diagnosed. So it's a project that's very close to my heart, to my family's heart, and we're just pressing on because this month, March, is recognized globally as Endometriosis Awareness Month. So we are pushing for increased awareness.
Mm-hmm. If I'm watching Dr. Christie and I'm concerned, or I may even suspect that this is what's been happening to me, what steps should I take?
First thing is seeing a healthcare professional who is trained to see this. So it's endometriosis, comes from the womb, so it's only going to be seen by women. So go to see a gynecologist. The symptoms are quite often classical, as we said. Painful periods, the pain starts before. Actually, many people are asymptomatic, so they won't have signs and symptoms, but it often presents with infertility. So if you've been trying to get pregnant and you haven't found a cause, quite often it's diagnosed as endometriosis. So the first step would be seeing a gynecologist. Coming up with a diagnosis. On examination, you can find nodules, you can find it's pain. Or another thing that they often present with is pain during intercourse. So if you're seeing this type of symptom complex, see a gynecologist. They will either be able to do surgery or medical management, or have you referred to subspecialists in the area.
This was going to be my next question. Before it even gets to stage 4, is there management of it? Is it treatable?
Oh, absolutely. It's treatable. The treatment will be medical or surgical. Now, if you can, it's a hormone-driven disease. So if you can suppress the hormones that supply the tissue, then you can suppress the disease. And the hormones that drive it are the same ones that drive your menstrual cycle. So simple things like continuous use of oral contraceptives or their injection, their Depo-Provera. For patients who are really severe, who are trying to get into surgery, then we have other hormones, GnRH analogs, a bit more expensive. They work well in the short term. But the main treatment is surgical right now. You need to remove the deposits as much as possible, and then you go on to suppress.
All right, 10 minutes is never enough, Shauna. For those who are watching who want to get more information, how do they contact you or the B.A.S.E Foundation?
Well, first of all, I have to acknowledge that Her Excellency the Most Honorable Lady Allen is the patron of our foundation. But we're actually on, we have a website, B.A.S.E Jamaica.com. We're on Facebook, Facebook.com/B.A.S.E Jamaica. We're on Twitter, B.A.S.E Jamaica. And you can email us at hello@BASEJamaica.com. For this month, we have a Wear Yellow for Endo campaign where we're selling yellow ribbons and yellow pins to raise money, which goes towards our objectives, and these can be found at all Kingston Bookshop locations. So if anyone is interested in purchasing, you can reach out to us. If you're interested in selling, reach out to us as well.
All right, and I always think prevention is better than cure. So if you're not sure, just go have it checked out.
Absolutely.
And be sure. Thank you so much, Dr. Loxley Christie of the Hugh Winter Fertility Management Unit and Shauna Clarke, founder of the B.A.S.E Foundation. Herself, diagnosed with stage 4 endometriosis, but doing well. I'm glad to see it. And that's 10 minutes to your help.